So oftentimes I get asked about the signs and symptoms a woman should be aware of to alert her gynecologist about this. There may be a potential problem, or there may be potential fibroids. Abnormal uterine bleeding is the first one, right? So women suffer a lot with bleeding, and bleeding can be excessive. Like if you're changing pads every hour or every 2 hours during your menstrual cycle, this isn't normal. This could be an indication that there's a growth like a polyp or a fibroid or even endometriosis or adenomyosis, things that are forming in your body that are causing you to bleed abnormally. Don't suffer with extremely heavy bleeding, because that is not normal. Number two is pain. You should not be in extensive or severe pain during your menstrual cycles or even off your menstrual cycles. Sex should not be painful. Like when those things happen and you start to feel pelvic pain that's abnormal, that's something to alert your gynecologist about. Or if you are not seeing someone, to go and seek some type of help for that, because you should not be experiencing pain. Infertility is different, because there's so many different things that encumber infertility. For instance, there's male factor infertility. There are different things that, like not having sex at the appropriate time, like that can contribute to infertility. It doesn't necessarily mean that you have fibroids that are preventing you from getting pregnant, but if there have been, significant time in which you are attempting to get pregnant and are not doing that, it's definitely worth having a discussion with your OBGYN to see, if there's a potential problem. If you start to feel hard masses, like if your belly starts to feel hard or starts to protrude all of a sudden, or it becomes uncomfortable for you to sleep on a particular side or sleep on your belly, or if you're trying to do abdominal exercises or any type of workouts in the gym and you start to feel pressure and pain down in your pelvic area, this is definitely an indicator for you to go and see professional evaluation to make sure that there's not something that's going on, or a growth of like a fibroid that is happening in your uterus or in your pelvis that's causing a problem. So these are some very, very strict indicators as far as like when things are wrong, that there could be a potential problem. So listen to your body never fails you, and always seek help if you think that anything is wrong.